This patient came in pain on tooth number 15, and you can see this was a virgin tooth, and there is some periapical pathology going on that looked kind of weird, so I decided to do a limited field of view 3D CBCT on this case. So this is the bone rendering here, 3D bone rendering from the buccal aspect, and on tooth number 15, which is here, everything looked pretty intact. But as we look at the palatal aspect, we can see that there is quite a bit of bone loss here on tooth number 15. And if you look very closely, you can see here she has a vertical root fracture that actually turned into a split tooth. You can see it right along here with the 3D bone rendering from the palatal aspect here. Very nice images that's captured by my CS 8100 by Carestream. And as we look at the axial slice here, we can see that this is a split root here. I'm sorry, this is the coronal. This is the axial slice. And we'll be able to also see the same thing here through the coronal slice. Now, if this tooth was root filled with gutta percha and also had a post, you probably wouldn't be able to see this crack so clearly. And studies by Platuno talks about vertical root fractures and split teeth are very hard to diagnose on CBCT due to the scatter from the metal artifact and also from the scatter based on the barium that's in the root canal filling material, also the radiopacifiers in the sealer. So this tooth unfortunately has to be extracted and get an implant.